Welcome to the Yoga Teacher Collaborative weekly live show and, of course, our podcast edition. So, this is a very special guest session that I'm really delighted to host for many a reason. If you are new here, my name is Laura Green. I am a yoga teacher, a teacher trainer, a business mentor, and an author. And these sessions are here to help us all learn and thrive so that we can grow as yoga teachers, but also so that we can support our community in the absolute best way possible. I adore community yoga teaching. I recommend building your communities and building relationships with your students so that you are in each other's lives, enjoying the magic of yoga for a long period of time. And obviously, if you are working in your community over a long period of time, unfortunately, health conditions are going to arise. And one of those health conditions and health challenges that we're sadly having to face and more times is that of cancer diagnoses. Whether it's a student that's been in your community for a long time, that's had a new diagnosis, whether it's someone starting yoga following treatment, or even as they've received a diagnosis, it is a part of the everyday of being a yoga teacher. So this is why we have this session today with Jenni Stone on cancer awareness for yoga teachers. And what's really struck me when reading Jenni's work is she often leads with why all yoga teachers need to be cancer aware. Now, I know I have lots of yoga teachers in my local community that do specialist yoga for cancer classes. They work with different charities. But even if that is not the route that you're heading down, we cannot escape this in our everyday community. And the more informed we are, the more of service we can be. So, to help us with that, Jenni is very kindly giving up some of her time today to support our evolution. Jenni also has an upcoming 90-minute free training on yoga for cancer awareness or cancer awareness for yoga. Either way around, and a 1-day course and a 10-week course coming up as well, which if you're loving what you're learning today, I'll share more of that at the end. But for now, let's soak up this wisdom and kindness from Jenni. Jenni, thank you so very much for being here. I'd love you just to take a moment to introduce yourself to our family.
Oh, well, thank you so much for that lovely welcome. Yeah, I really do love spreading the word about this topic that I'm so passionate about. So for people who don't know me, I'm Jenni Stone. I'm a yoga teacher and a reflexologist. I've been, as a combination of the two, I've been in practice for 23 years. And through all of that time, cancer has been part of my practice. So I've supported people in hospice, in breast cancer charity, in private clinic, in their own homes, and currently, and for the last, I lose track of time, about 9 years, I've been working for Maggie's at the Royal Free, that's in Hampstead, North London. So I'm teaching classes there every week and helping them develop the yoga program there for all their centre visitors.
And what I loved when we were chatting off air is that you were saying you do two classes for Maggie's, one being a chair class and one being a mat-based class. And also you do private one-to-one yoga, some of that being for female health and some of that being for people during their cancer journey. So actually you're using your knowledge in a few different applications through yoga.
Yeah, and interestingly, and this is partly what the free training is on, is that there's often an overlap with women's health and cancer. So, breast cancer is the most common cancer in the UK of all cancers anyway, and then it is also the most common for women. And so, there is that impact in women's health, and the treatment then that goes on to affect potentially things like fertility and the menstrual cycle and bringing on medical menopause. And so it was interesting how what felt like two separate strands of interest actually intersect quite a lot, sadly. But yeah, it is an important area for me, I think.
So it's wonderful to see how you can go on to do specialist work. And I know with your for Cancer Academy, that's a lot of the training and education you do is supporting people going on to do specialist work. Before we get to exploring that, why, aside from the obvious, do you think that just, no, I'm not teaching a specialist class, I'm just teaching a community class in a village hall, in a gym, in a yoga studio? Why do you think it is important for us as yoga teachers to know more?
I suppose it is really the most obvious answer is that as a, in the Western world, and I'm assuming these figures bear out amongst other countries, but we're nearly at a rate of 1 in 2 people having a cancer diagnosis in their lifetime. So it's half the population at some point will get some sort of cancer diagnosis. So it's not a niche area. Like people sometimes think, oh, that's like very ultra specialist. But if it's going to be something that affects half the population, then I feel like we all need to have at least a basic understanding of what does it mean when you have a cancer diagnosis, a basic understanding of the potential holistic impacts on people, the useful language and the not useful language to use in those conversations. And it's, I suppose, in the way now we're much more aware of being trauma informed in our teaching, even if you don't want to be a trauma specialist.
Yeah.
I feel like we need a level of being cancer informed, because sometimes those conversations catch you off guard. That somebody might at the end of a class go, oh, by the way, this is going on for me, sometimes. And so we need to be a little bit prepared. So I think if we have that little bit of basic training, that foundation level, so that as and when, because I do feel sadly it probably is inevitable, somebody says, oh, I've been having this checkups and they've told me, yes, actually, I now have a cancer diagnosis, that as a teacher, you're not kind of winded or kind of sideswiped by that you have in your toolkit a suitable response, that you have an understanding of whether or not you're able to continue integrating this person into your class, what adaptations you might need, or whether this is a situation that's beyond your training and actually you need to refer to something more specialist, and maybe to already know what services are in your area. So you're not just saying, oh, I'm really sorry, like, I don't want to damage you, I don't think I can help you, and that's it. Like, we want to feel like we can continue to walk alongside somebody and say, yes, actually, I can integrate you into my more gentle class. Like, maybe this class isn't great, but I can move you into this class so we can still work together. Or that it's actually, this really does require more specialist teachers at this stage, but when you're ready, you can come back. And in the meantime, here's some information to get the support that you need. And I'm still here if you want to come to the meditation class or do my yoga nidra or whatever other things you're offering. So you have a good sense of how you can support someone and where your boundaries are. And I think
overriding thing I've just noticed then is, having been a teacher for a long time and having had this experience many a time and myself no further training in it, I've struggled to walk that line between respect and compassion as a human, knowing people can be very personal and private about medical diagnoses, and understanding how much I need to know to be able to support you. And that was my overarching takeaway then, that actually I probably go into the support side and that I'm here for you, giving the person time to talk. And I probably am not actually asking the questions I need to ask to know, am I able to support you in this class? I think I leave it to that person to, okay, see how you feel, see how the treatment you're feeling is, and what energy levels you have, communicate with me on how you're feeling. But what did you think the sorts of questions that someone should ask whilst respecting privacy? Like, what questions, if you were to tell me, I'm pregnant, I know what questions I'm going to ask. Okay, so, how many weeks? Is this your first? Has there been any complications before? Is there anything you're experiencing right now? I know the questions I would ask. But what do you think the questions I should ask at a point of, because obviously we've got diagnosis, supporting someone during treatment and supporting someone post-treatment. So what do you think at diagnosis are the questions we should be asking?
It's a really good question, and it's quite, yeah, again, even something that simple can be quite a big area. But I guess in a nutshell, you want an overview of what their diagnosis is, so you know what part of the body's affected. And this is something we go into quite a lot of depth in the course. Like, the more you understand what their diagnosis and treatment means and how that might affect them, the better understanding you have of what their needs are. But I think as a very simple level is, where are you in this journey? Like, has the diagnosis been confirmed? Have you started treatment yet? Or have they given you a treatment plan? Do you know if you're having surgery and what type and when, for example? Do you know at this point whether or not you might be having chemotherapy and when? So you can start to build a picture of, on a practical level, what might be going on for this person. And I think the key question to ask them outside of those more medical things is, what do you want from your yoga?
Mm,
Because we can offer a lot of different things. And depending on the reason that they want, whether we can determine how we can support them. So, for example, somebody may have a very complex medical situation that we feel maybe we're not equipped to do like a full asana-based class. But if the reason they want yoga is to manage their anxiety and to be
yeah.
able to sleep, then if we offer a nidra class or a relaxation class, it's like, well, you can come to that. So knowing what they want from their yoga. Other people, it may be, as a very common thing, I'm having breast surgery. I want to regain my range of movement afterwards. I want some rehab post-surgery. I need to be able to do my normal day-to-day things. And I want to get back to my hobbies. I want to be able to pick my kids up, like literally pick them up.
Yes.
So it can vary a lot depending on what's going on for someone. So I think asking them what their goals are, what their needs are, can help you then work out what it is that you can offer them as a teacher.
Is that because there's things that get lodged in our brain? We don't know where these things come from. We don't know if they're fact or fiction, and they get lodged with like this alarm bell. And an alarm bell I always have is when like massage therapists won't treat anybody with and I don't even know if this is still the case, or it's just something that's lodged. They won't treat people that, have cancer, and there's always something about because of the lymph nodes and this, that, and the other. And then that factors into movement. Is there ever a situation where it is not safe? If someone has said to me, what do you want from your yoga? I would like to still be able to come to maintain a sense of normality in my routine, have an hour a week where I'm not thinking about being a cancer patient. Please just let me do my normal practice. Is there ever a time when that wouldn't be safe?
Well, I suppose it depends what you mean by safe. In terms of spreading cancer, that is a myth. So movement in itself is not going to spread the cancer. And what recent research has shown around exercise in general is the more active someone is able to be, the better their outcomes are. So, and this is also why I'm keen for teachers to be prepared to work with people with cancer, because medical teams are now saying you need to stay active. You need to stay active through your treatment as soon as possible after surgery. Like, they know that it gives better outcomes, and they're recommending yoga as a safe practice because you don't want people to be going off playing rugby or, these fast impact sports are not suitable, but a yoga class is, if it's the right kind of yoga. So the movement in itself, we need to not be scared about that, in that our lymph should be flowing around our body all the time anyway. Our blood circulates. We need to move to not stagnate, to be healthy. And a lot of things that we do in a yoga class, we kind of do in day-to-day life anyway.
Yeah.
We reach up and we open a cupboard, we bend over and tie our shoelaces, we crouch to the floor to pick something up.
Yeah.
So those things, I think, don't be scared of that. I think more where some people might need a little bit more training is around maybe what type of movement and how strong to make it is suitable for each individual. So if it's quite soon after surgery, we do need to be careful about the level of movement that we have. If people are, they may have a port in their chest, or they might have a catheter in their arm for receiving chemotherapy. So they have something permanent, so that they're not having to reopen a vein every time they go in to get their treatment. And so
that was called a port in the chest or in the arm?
Yeah, a PICC line. It's basically a permanent catheter. And so there's certain considerations that we need around those situations, and just understanding people's energy levels and how their medication is affecting them. So generally, I teach classes that are slow and mindful, and there's something about, and I guess it's almost like a parallel, say, with postnatal recovery, is that once people are in treatment, they kind of are experiencing a new body. So there's if they've had a yoga practice before, there is some reference points that they'll have, but it's also their body is different. And it's giving the time and space to really explore this new terrain, find out where the edges are, what feels okay and what doesn't, and kind of working together with the student to let people move slowly and feel when they get to the point. And I think intuitively, we often know, don't we? Like, if we've been working with an injury, if you work slowly and you go, oh, okay, that's my limit today, and maybe just hold and breathe there. So, that's one of the principles that I teach, is that if we're slow, we're mindful, we encourage a lot of interoception and introspection, so that the student themselves can feel what's okay for them and what's not. Then we can start to shift some of our teaching language around that, and that's a way that we can help to keep people safe in our classes.
And I think that's beautiful instruction personally for all yoga anyway. I have one gentle yoga class on a Monday and one chair class, but the rest of mine are a vinyasa, but they're taught from let's explore one version of this pose first, see how this feels. Then maybe there's options for other variations. But I think even in there, there's so much time and space for people to move slowly, see what's happening in their body today. Obviously, you said things like the PICC line and the port, and obviously cancer just can be so very, very different in every single person. I imagine there's no like mandatory contraindications like there is with pregnancy. It's all very, very situational based.
It is. I would say generally not as a contraindication, but just as a rule of thumb, once people have started treatment, just have them ask their medical team, is it okay for me to go to a yoga class? Because what we're not equipped to know, because, even with my experience, like I'm not an oncologist, I can't determine whether or not it's okay for someone to do exercise. Their doctors need to tell them, because they may know things that I don't. So once they've got the all clear and they said, oh yeah, absolutely, you should be active, please do go to a yoga class, then that's fine. So I think that would be the main thing I'd say to anybody is just you won't ever get like permission slip from the doctors. They're too busy. They don't do that. But have your student check in with their team and saying, I want to do yoga. Is that okay? And if they get the all clear, then we're okay to work. So that would be my sort of number one tip for that.
Yeah. And I guess if you're, constantly in some kind of contact with your team, it's easy to just say on a regular basis, am I going to go to yoga today? And I'll say the same as someone going to a chiropractor. I don't really want to see you the same day you've had the chiropractic treatment. So ask the chiropractor, like just every time, hey, is it okay for me to go to yoga this week? Is it okay for me to continue? Just getting into that habit of it. Is there anything that you notice just anecdotally with how certain treatments affect? I'm thinking things like, is anything going to make people more likely to have a head rush or be lightheaded or dizziness? Is there anything you anecdotally see often?
Yes, I mean, chemotherapy is quite a biggie. There's a lot of side effects. And again, not everyone gets all of them, they can vary. But generally, I think I notice through a lot of different treatments, including surgery and radiotherapy as well, fatigue can be a big issue generally within cancer. Stress and anxiety is pretty much universal. So you know that those things are going to be in your class. And then in terms of other side effects, peripheral neuropathy can be something that we need to be mindful of as yoga teachers.
Let me just check. That's
yes. So
it's
a kind of pins and needles, numbness, strange nerve sensation in the hands and the feet, more often in the feet. So there can be this sensitivity, and so this can really affect people's proprioception and their balance. So we need to be mindful of things like that. They may also find that their hands and feet are very sensitive. So I had someone yesterday in class who wanted to keep socks on because the contact of the bare skin with the floor just was a bit overwhelming because of the way the nerves were firing off all the time. So that's an example of something that can be quite a common occurrence. Nausea is less of an issue, but I do still have people who experience nausea with their chemotherapy. And generally, people can find, and this is why I like to do a slow class, is that I think with the fatigue, with the kind of heavy medication that some people are on, dizziness can be an issue. So nausea, dizziness, and sometimes it can be the cancer itself. If they have some kind of head cancer, that can give them dizziness as well. So always having options and being quite slow in the transitions. So it's why I generally don't, in my cancer classes, do a vinyasa as such, because I find the standing up, get on the floor, stand up, get down, is just a little bit much for quite a lot of people who are going through treatment.
On multiple levels, with the dizziness, the pins and needles, or the loss of feeling in the feet, and with the fatigue, it's like a double whammy on them. That might be challenging.
Yeah, and they can just generally be, and certainly I find when women are on they've completed their chemotherapy, and if they have hormone positive cancer and they are on estrogen suppressors afterwards, so things like tamoxifen, Arimidex, a common side effect with those is joint ache and muscle ache. So that can be a really common experience for women in those situations.
And even that's just, really a lot to start to make us think about how we can be more understanding, how we can ask the right questions, and how we can support someone. Going back to what you said at the beginning, you were talking about language and what to say and what not to say. I would love to delve into that a little bit more with you, please.
Yeah, it's sort of one of those things you sort of have to smile about, because sometimes the things that people have experienced are quite shocking and awful. I think I suppose as a very easy takeaway, if you remember nothing else, just remember, assume nothing and just ask them how they are and what they need. So it's asking questions and veering away from telling people how they should feel or sharing your own stories. I think sometimes, particularly if you're caught off guard and you're not prepared and someone's just told you they've got a cancer diagnosis, there's this, oh God, what do I say? And that's sometimes when inappropriate things come out. And it may come from a place of trying to show understanding and compassion. But what might come out is actually not helpful for people. Like, oh my God, that's awful. You must be so scared. You must be feeling like this. You don't know how that person's feeling. And so
And if I'm feeling scared and someone else tells me I should be feeling scared, that almost feels like it validates I have something to be scared of.
Yeah,
that feels a lot.
Exactly. Or sharing stories, again, it's not helpful for the person, because then it's taking away the conversation from them to say, oh yeah, my aunt had that exact same thing, and let me tell you about her story. And often what tends to happen is that, and I'm not saying of teachers specifically, but just of people in general, is that they may have a lot of their own unprocessed stuff. And so when that story comes up, when someone presents their own diagnosis, it triggers something in us. And then there's this need to share this traumatic experience that we've had, which is the last thing that someone with a new diagnosis wants to hear, is how someone's loved one had an awful time and then died.
And I guess the other way as well, like, oh, my granny beat that.
Yes, it goes both ways. It does. And actually, that's the other thing that I feel really passionate about, is what I call the toxic positivity.
Yeah.
It's like, you must say positive, only good thoughts, stay strong, you have to fight this. And again, it's very instructional. It's telling people what they should be doing, which I think is not helpful. And again, it starts to invalidate their feelings. It's perfectly healthy and normal to have some degree of fear, of thinking of all the different possible outcomes. And so what I like to have in class is a space that people can bring whatever they're feeling, whether it's fear, sadness, rage, disappointment, optimism, hope, like all of those things are part of what makes us whole. And I think we can't really heal if we don't release these emotions. And when we say you're only allowed to be positive, it builds this kind of negative loop of course, there's some stress and anxiety, which is normal, but then people feel guilty. It's like, oh my God, but I'm so stressed, and this stress is going to make me sick.
Yes.
And how am I ever going to get better if I can't be positive all the time? It's, it's really unhelpful. And so, yes, I do love affirmations and I think they're useful. And acknowledge the sadness, give it some space, acknowledge the fear, just, allowing all of those things so that we can be a whole person and not try and fracture internally these bits of ourselves that are not allowed. Like, yoga is union, it's wholeness. So we need to allow all of those things as part of that journey.
I wonder if this is too basic, and do just tell me.
No, there's no such thing.
But there's a part with me that would like to ask you, so I presume it's going to be helpful. Please, could we role play the conversation? If I was to say to you, I've been coming to class, Jenni, can I have a quick chat? I just want to share with you that I've just recently been diagnosed with breast cancer. As a role play, can we do that?
Yeah.
So let's jump off from there. Jenni, just share with you, I've just recently had a breast cancer diagnosis.
I'm really sorry to hear that. How are you feeling about that?
Just quite shocked at the moment.
Yeah, it's really understandable. Have you had any feedback yet about any treatment that you're going to receive? Have they given you that information yet?
I'm still waiting for my treatment plan, but they've mentioned there might be a surgery or maybe a chemotherapy.
Okay, that's fine. So, what would you like from here? Would you like to continue coming to class? Is that something that you'd find useful?
I would like to, because the yoga is such an important part of my week. But I'm scared. I don't feel like I know everything. I feel quite scared.
Again, that's really understandable. I think, in my experience, there's a whole range of emotions, and this is very new. There's a lot you don't know. You're carrying a lot of uncertainty. So everything you're feeling is completely normal. I think moving forward, so that I can support you best, it would be good if we just stay in conversation about what treatment is upcoming for you, so we can make sure that you're in the right class and that we're doing the right things for you. So as and when you get that information, you might get a date for your surgery. Like, we can carry on that conversation and we can find what works best for you. What I might do, if that's okay, is just send you my health questionnaire again once you get more information, so that I can just keep that in hand, so I can see what's potentially coming up. And you let me know how you're feeling as the treatment progresses, and we can adjust as necessary. And there may come a point where you feel this class might not be the right one for you, and we could move into a different class. So, there's nothing set in stone at this moment. We can just keep working together and we'll adjust as necessary. And anytime that you've got questions or concerns, then just get in touch and we'll carry it on from there.
Yeah, really confident. Yeah, it feels a really good conversation. And the health questionnaire. I mean, obviously, if someone tells me in class that they're, pregnant and they'd like to get, and they've been a student of mine for a long time and they'd like to continue, yes, we send a more in-depth health questionnaire. Is that the same for you, or is it your same standard health questionnaire?
What I've done now, I suppose, just out of efficiency, and because quite often there's overlap. So I had thought before about having separate forms for different things, but often I've found that, I had a pregnant woman in a cancer class. And so I do it all in one. And I include in there questions around, all the normal health things and about cancer. And there's space then for people to say, what medication are you on? Have you got any upcoming surgery? And that can apply for other health conditions as well as cancer. So it's a more in-depth questionnaire now that I do for everybody. And then it just keeps it all in one place. And then if people are moving between reflexology and yoga, which some of my clients do, then I'm not asking them to fill in like 5 different forms for things over time.
And I think the medicine point's a really good point to raise, because we literally just covered this on my teacher training last weekend about, in a standard class, if you're asking for certain information, you're then giving a level of expectation that you understand that information. So I say to mine, like, don't ask for medication in a standard class unless you are prepared to take responsibility for knowing what that medication is. But I guess, especially if you're going to be working in a more specialist setting, is that the kind of thing that you cover on your courses? Like, these are the common cancer medications. So if people are asking that question, they're knowledgeable on the answer.
So we don't go into depth about medication per se, but I give some resources where it's very easy. Like Cancer Research is a fantastic website, and you can type in the medication and it will bring up what it is, why you have it, what the side effects can be. And for me, particularly with my Maggie's class, and this might not apply to people elsewhere in the country, but I have a lot of people who don't have a very high fluency in English. And I find that the health questionnaire can miss important things. Like maybe they don't fully understand all of it, or they're not always able to express everything. And so it's a way for me to get a bit of extra information. And it's interesting sometimes, like people will say no to one question, but then when they list their medication and I do a quick look on what that is, it's like, oh, they should have answered yes to that question.
Yes.
So it's not to say that like I'm not a pharmacist or an oncologist. I don't know all the medication. There's some that are more common that I'm more familiar with. But it just enables me to look up. It's like, oh, so you are on chemotherapy then, when they've said they're not in treatment or something. Do you know what I mean? Whereas, if you're in a different part of the country and everyone has English as their first language, it might not give you that much more additional information. But I do find that useful to just look up and see what side effects there are, and it gives you a little bit of an idea of what some of the issues might be that they're dealing with.
And also it's just making someone feel like they're seen, they're welcome, they're acknowledged, they're held in that space by you, and that you care. There's so many questions, but I know this is why you have this free training upcoming. You have the 1-day essentials and you have the 10-week course. So although I have a million other questions, there is just one I wanted to finish on, which was something I started to ask you off air, which was how you look after the emotional load yourself, especially because, you're not just supporting people in the community, but you've chosen to work in a hospice environment, to work in a charity environment, to support people at, some of the worst times in their life. How do you deal with the emotional load of that?
Yeah, I think it's a really important question. And it's definitely something that is a thread that runs all the way through the long training that I do, because what I want people to have is a sustainable practice. And so part of that we know is on a financial side, but a big part of it is our personal well-being, that I don't want people to get to a point where they feel like they can't do this anymore, and then they're not out there helping people. So our own self-care is really important. And so for me, it's been building in buffer zones in my day, in my week. And so as a practical example, on Thursdays, which is the day that I go into Maggie's and I teach my 2 classes, my day now allows me to do a walk of the entire length of Hampstead Heath on the way there and all the way back. And that
Yes.
gives me a half-hour walk in nature to kind of ground myself and prepare for teaching. And it gives me that space to process, conversations that might have come up. And that it's not just back to back, run from this, run to that, and then we don't allow ourselves time to process those things. I think also working in a centre is really helpful, that I have support there. So if I need, there are specialist members of staff that I can talk to. And for myself, I've had a counsellor for about 10 years now. And that's a place for me to work on my own stuff. Because I think when we work in these situations that, like you say, can be some of the worst times of people's lives, it can be very triggering for us, and we need to not project our own stuff onto people, because we need to be strong to hold space for them. So we need somewhere outside of our teaching that we get support, that we process things. So in a nutshell, I would say, don't try and do everything on your own. It's normal and necessary to need support, and you need to build a support network for yourself to do this kind of challenging work. And that can look different for different people depending on what our needs are. But it's a really important part of doing this kind of work, I think, is to make sure that we're good.
And
We're
that
okay.
just constantly remind me of that big missing aspect of yoga is supervision,
Yes.
of the supervision circles where we can just sit in a small group of people, share, process. Yeah, it's just not something that we have, but I guess it's something that we can informally set up. I know I have a circle of friends that we do exactly that, but it's just
Right.
a big missing link in our industry.
It is. It's huge. And it's also why, I've been building a bit of a community for yoga teachers as well. So that's why I have my Facebook group. I wanted to have somewhere that people who've done training with me can have a place to come to get some additional peer support, ask
Yeah.
questions. I suppose one of the niggles I've had from some trainings that I've done that I've loved, and you have this 1 week intensive and it's been amazing, and then it's at the end, that's it.
Yeah.
There's no more contact or support. And so it's been an important thing for me to address that and make sure
Yeah.
there's ongoing support for
Because
people.
actually the stuff that comes up where you need the ongoing support is after the training. It's then when you've gone
Yes.
to percolate, implement, share, that's actually the time when they're, oh, but
Yes,
comes up.
exactly. So yeah, it's not till you're really putting it all into practice, and it might be 6 months, 2 years down the line, that something comes up and you think, oh, I really need some support with this, or I don't know how to handle this situation, or I'd like a second opinion, or whatever it is. But to have that group support, that you're not just adrift trying to work out everything on your own,
Yeah.
is really important.
Yeah. This has been an illuminating toe dip. And I would now like to swim in the ocean, please. So the next thing that you have coming up is the free workshop on the 17th of July. That is a 90-minute workshop. Roughly, what would someone learn from that? What would be the format of that?
So we're looking specifically at the additional impact that women can have from their cancer treatment. So it's this overlap between cancer care and women's health, and ways that we can support women who perhaps are being put into early menopause from their cancer treatment, supporting women who may have lost fertility through their cancer treatment. So looking really specific at these areas, because again, this is something that can show up in your class, and that there are all these additional needs that women can have. So looking at that specifically.
Yeah. And then the 1 day essentials course, that sounds really good. What is the expectation of learning from that?
So the essentials is kind of what it says on the tin. So we're looking at, I consider there's 4 modules in that. It's a 1-day workshop, and it gives an overview of understanding cancer diagnosis and treatments and that holistic impact and the side effects. We look at communication skills, teaching language, boundaries. We then look at some specific modifications for actually building lesson plans. What are the underlying principles for putting a cancer class together, and some of the modifications. And then we also look at building support networks for ourselves and for our students. So it's this foundation level, which I think is useful for all teachers, whether you want to be a specialist or not. That it just gives you that foundation level understanding. So when that conversation happens, you're equipped to deal with it.
And if you did want to go on to be a specialist, be able to run classes in something like Maggie's, as you suggested, or the other charities, that is when someone would do your 10-week course?
Yeah, so that is a 60-hour Yoga Alliance accredited teacher training course.
Yeah.
You need to be a qualified yoga teacher first.
Yes.
And then this is the postgraduate training. So yeah, this is a 10-week course. So we go into a lot of detail. And so in addition to those modules I've mentioned, we go a lot more detail into lesson content. So we look specifically at all different kinds of asana, pranayama, meditation, restorative practice. You get teaching practice on the course, writing lesson plans, lots of personal development as well, and working together with other members of the cohort as well. So each group is like a little community in itself. So yeah, that starts at the end of September and runs to the end of November.
Yeah, I mean, it's a real great range of offerings for someone that's just, I'm just starting out teaching in my community, or just like to feel a bit more confident, because sadly I know a situation is going to happen, to obviously I would like to offer specialist classes. But just to close, if there's one thing that you would wish yoga teachers to know to be able to serve a student better in their community class, what would that be?
Oh gosh, brevity is, as you will have realized, is not my strong point. I think that everybody is unique. So everyone's diagnosis and how it affects them is a unique situation. So not to make any assumptions, and yeah, to ask them, how they are and what they need. So it's always case by case. There's never a one size fits all for when you're working with cancer.
How are you and what do you need? I'm going to ask a follow-up, sorry.
Yeah.
I have a couple of students that are unwell. And every time I see them, I want to ask, how are you? But I sometimes feel they don't want me to keep asking, how are they? Like they just want to come in, be in the corner, do their yoga. How do you manage that process of how often should I be checking in on someone?
I think there can be a lot within the way that you ask, how are you? So there can be the very, how are you? The very serious, Or it could just be quite light. It's like, hey, how are you today? What do you need?
Yeah.
Keep it quite light. I would
Yeah.
ask them every week. And yeah, and I think actually adding the word today
Yeah.
is a nice little refinement. It's like, how are you feeling today?
Yeah.
You know, what are you up for in class? What do you need? And
Mm.
so it's
Mm.
not the big question of how are you coping with this whole
Yeah.
situation?
I love that. What are you up for in class today? That sounds quite light and almost fun, rather
Yeah.
than what are you not able to do today because how sick are you feeling? Like,
Yes.
it's totally different wording.
Yeah. So this is where language can be so powerful.
Mm.
But yeah, and actually, I suppose, you know, just to let people listening know who might not have worked with cancer, that I generally find my specialist cancer class to be some of the rowdiest classes, that you know, it's not somber
Mm.
most of the time. I think there's a little bit of gallows humor in there. Um, there's something about serious life situations that gives a little bit of perspective. So I find a lot of people in class, they're not sweating the small stuff.
Mm.
They're up for having a laugh. They need a bit of a break from the heaviness. And because yoga is something that they love, and I try to bring a little bit of humor into class as well, and like just keep it a bit light and break
Mm.
some of the tension.
Yeah.
Um,
And you're
yeah,
right, and that comes from you. You know, I wouldn't second guess. Most weeks I say to most of my students, hi, how are you doing?
yeah,
You know, it's the seriousness you put on that as a teacher. Yeah.
yeah. And if you know there's something big coming up, like they're having a follow-up scan to see if the
Yeah.
treatments worked, then that might be a thing that you just quietly say to one side, you know, how's it go? Are you okay?
Yeah.
You know, because that has more gravity to it, and it's a specific thing that you know is a big deal.
Yeah.
So it's feeling into tonally what's appropriate in different occasions. So I hope that's
That is
helpful.
so helpful. Thank you very much. And I feel really good from having this conversation with you right from that moment when you said, actually, move in an
Yes.
appropriate way, move. Don't be scared of movement. Don't be, yeah, is move. So what I'm going to do, my lovelies, is put a link to the upcoming courses with Jenni. If you're watching this on the Facebook, I'll put it in the comments and I'll also put it at the top of this video. If you're watching this on the podcast, I will put it in the description below. And if you found this via the email, it is in the email. So I'll make sure those are easy for you to find as well. One thing to say, if you can't do those dates, please don't worry. Jenni's recording it all. And if you've signed up and registered, you'll automatically get the replays anyway. So if you can't do the date, just sign up as if you're going to do the date and you will get those replays. Jenni's also a very supportive member of the aThe Collaborative. So, you know, if you're asking questions on our Troubleshoot Tuesdays and things, Jenni's often there in the comments, which is how I've got to hear so many people that have done your course and rave over it and recommend it so highly. So Jenni, thank you so much for your generous time. I know you're in clinic today. You've got people coming in from 12 ready for your healing hands and their reflexology. So thank you so much for your time. Just going to pop over and end our live show, my lovelies. And we will see you again very soon. Thank you for being here.